Hi, everybody. This is Dr. Meaghan Kirschling from One Agora Integrative Health. And I wanted to talk a little bit about ozone therapy. It's a treatment that we have here at the clinic that we're very excited about because there's so many health benefits. I know that there's a lot of questions about ozone and what it can be used for. So I wanted to describe what ozone therapy is, how we use it, and who's a good candidate. So what ozone therapy is it's utilizing O3. So oxygen, if we remember back to science class, oxygen is O2. And that's the form that our body uses and the environment has a lot of. So we breathe in oxygen and our earth is obviously oxygenated. Well, we can use O3, which is a little bit more of an unstable molecule, to bring more oxygen molecules to our body. It will then make the O2 so that we can oxygenate our body. It's fantastic. It has huge effects and benefits on the immune system, on the nervous system, and just in general health and wellness overall. When we talk about ozone, there are people that are great candidates for it. So we can use ozone to help to go after any kind of infection. When we look at infection and even tumor cells and cancer cells, one of the big thoughts is that if we can oxygenate the body and if we can oxygenate the tissue, then the immune system can fight anything off and our bodies can heal. So if you have an infection like a sinus infection, a recurring ear infection, a GI infection, then we can use ozone locally in those places to not only oxygenate and get rid of the infection, but also to upregulate and boost the immune system. Then there is the conversation about overall ozone therapy and just getting O3 up in the body so that the body can use it more. This can be done really in two major ways. We can do it through IV ozone and we can do it through rectal ozone. When we do use rectal ozone, which is obviously the easier and safer way to do it, that we can use that in order to be able to get the body to absorb it and use it throughout the body. It has about 80% of effectiveness compared to IV. So by using it rectally, we're only getting it a little less effective, but just as beneficial when we do rectal ozone. And then there is also IV ozone, and there's different kinds of IV ozones that we can use. Now, the next question that always comes up is ozone safe? And yes, it's very safe. It's actually been around for over 100 years. It was used a lot more in healthcare near the 1900s with great results. It actually went out of popularity a little bit as pharmaceutical drugs came in. But when we look at it, it has years and years of clinical information behind it and research. So when we look at it, not everybody is necessarily a great candidate for IV ozone. With IV ozone especially, there is an increase in free radical production, and that's the way that it works. So for somebody that's really healthy, ozone therapy might not be the best option for them if it's IV. They would do a lot better with the local options of nasal or ear irrigation or rectal. Also, if somebody doesn't tolerate and has a lot of free radical stress production, then that's somebody we'd want to go really slow with. And so we really do customize it to each person. So when we talk about this, that's where we can really utilize ozone with all the other things that we do at One Agora Health to make sure that we're optimizing your immune system, your health and wellness, and be able to get you better on every level. If you guys have any questions about ozone therapy, feel free to reach out to us at info@oneagorahealth.com or call the office at 952-681-2157. Thanks.